Hey people, I'm sorry I'm a few minutes late. My Windows box was being difficult, so I had to move my webcam and my microphone to another. It was just a bunch of technical crap. It was just last minute, be a pain in the ass technical issues. If somebody is seeing me on YouTube, please respond. I should be able to see both YouTube and Facebook comments, I believe, in the software. This is the first time I've tried to do YouTube, so if there's anybody there and you wanted to comment, that would be really, really good. I suppose I should put me on the screen too. So this is going to be about how I began my journey, and I am type 2 diabetic, or I was a type 2 diabetic. My diabetes is in remission after 30 years as a type 2 diabetic, and over 12 of those years, I was on multiple daily injections of insulin as well. Before I tell you how I began, I kind of got to tell you where I was when I began. When I was 21, I was diagnosed with type 2. I was not diagnosed at 20. Excuse me, I'm not speaking well. Those technical issues got me all flustered. I was borderline on the oral glucose tolerance test during my pregnancy with my daughter. The standards back then were different than they are now. So I was, today I would have probably been on insulin during the pregnancy. But the pregnancy, they tested me because my father was diabetic. And he gave me his crappy genes. But the pregnancy went well, and my daughter was born. Sometime later, when she was around 5 or 6, I was diagnosed with type 2 diabetes. So I was only 27 at the time. This is pretty darn young. Back then, it was very young to be diagnosed with type 2 diabetes. Today, children are diagnosed with it. Anyway, I had figured out, at the time I was working on my PhD in biochemistry, and I went to we didn't have blood glucose meters. I went to the library and I looked up the profiles of normal people, type 1s and type 2s, eating different mixed meals. And I came to the conclusion that the best thing for me, and I did this for most of 2 decades, was to eat a pretty low-carb diet. And that worked for most of 2 decades in terms of what I could measure, which over time meters became available and I could measure my blood glucose, and I pretty much mostly stayed normal during that time. So at age 44, I had acute pancreatitis, which basically means that normally what your pancreas does is drop a bunch of acid and enzymes into your stomach to dissolve your food. And if it leaks on itself, pancreatitis means inflammation, but it basically means you're leaking the acid and enzymes on your pancreas, which I can tell you hurts pretty goddamn bad. And my blood glucose at that point was over 300. That's US numbers, milligrams per deciliter. And it would not go down. It would not go down at all from that point. I was just stuck. Low carb didn't work. I even tried not eating for a day or two. I tried doing a no carb diet, just eating meat and eggs. And my blood glucose stayed high for a year. Would not go down. And I didn't do anything about this because I was scared of insulin, and I knew if I went to a doctor, they were going to tell me that I should take some insulin. So I just had this really ridiculously elevated blood glucose for a year. And then I had a little thing called a myocardial infarction, which is a heart attack. And they took me to the cath lab to try to put a stent in to clear the blockage. But there was some complications, and they couldn't reach, is what it came down to. And they put me on basal and bolus insulin to lower my blood glucose enough for it to be safe to do a bypass. And I was told at the time that it would take about 6 months for me to recover. So from there, I didn't recover. I ended up with severe chronic fatigue, chronic pain, and I was bedridden for quite some time. I eventually figured out that I had developed adrenal insufficiency, and going on steroids, very low dose of steroids, not like they give you for treating a problem, but a low daily dose, basically to replicate what my body wasn't making. And I also developed a problem with something called reverse T3, which basically means that the thyroid gland makes primarily T4, but your cells primarily use T3. And my liver was not making any T3. Instead, it was making reverse T3, which ironically enough is the hormone that makes bears hibernate. So I got those two things addressed, the steroids, and I was on T3 only meds for quite some time. But that made me better, but it did not make me all better. I was still pretty severely disabled. Sometime after this, I developed lymphedema in my legs, and it was really, really bad. And over time, I realized I had to be off insulin, the bolus insulin, which is the fast-acting insulin you take with a meal. Made my legs blow up. It would take 2-3 days for them to go down. And so I still was on basal insulin, which is the insulin you take once a day to keep your blood glucose steady when you're not eating. And because I was off the bolus, they tried me on a drug that is in the class of SGLT2 inhibitors. And I did read all the research because it was a pretty new drug, and I thought it was okay for me. But I wound up very, very ill in an emergency room with diabetic ketoacidosis. And when I explained to the emergency room physician that I could not have that because I was a type 2 diabetic, not a type 1, he asked me if I was on any of these drugs because they had since discovered that SGLT2 inhibitors can cause DKA. DKA is a very, very serious condition. I was in an ICU for a number of days with literally 8 bags of electrolytes dripping into my multiple IVs. And because my blood glucose was so high, the edema in my legs, which causes cellulitis, became infected. And I also needed to be on some heavy-duty IV antibiotics to try to clear up my legs. This is not a picture of my legs, because if you had tried to take a picture of my legs when they were this deformed, I would have punched you. But the lymphedema literally was that I could not put on socks and shoes. Sometimes at its worst, I couldn't even stand up. And I had an entire winter where the largest pair of men's slippers I could find was all I could wear. And like that means in snow. I couldn't get socks on, just the slippers. And lymphedema is very difficult. And like I said, this is not my leg. It's just an illustration I found. Then my daughter got very ill pretty much while I was still dealing with the lymphedema shortly after out of the hospital. She had a number of bad bouts of diverticulitis. And once that was surgically resolved, she died of an aortic aneurysm. And the reason I mention all this is not, oh, let's feel bad for Jackie, her daughter died, but is because I had a good year. I just went off the rails as far as my health was concerned. I didn't take any of my supplements. I didn't take any insulin. I didn't go to doctor appointments. I did not eat right. I ate crap like ramen and packages of Knorr noodles and stuff. I still ate a significant amount of vegetables because I like vegetables, but I just didn't care. I wasn't suicidal, but I also wasn't very interested in living for a good year. And I did attend a grief support group, and that helped a great deal. And eventually I did end up caring about life again. And that is Cynthia. Sometime after all of that happened, I woke up one day in a hospital in Baltimore. I don't live in Maryland. So I was in a different state in a hospital and had no idea how I got there. And when I found out what date it was, I had no memories whatsoever for 6 weeks. What had happened was I had gotten necrotizing fasciitis, which is the official term for flesh-eating bacteria. And I'd gotten an infection in my upper thigh. And at home, I'd gotten more and more irrational. And eventually my husband called an ambulance, and I went to the local hospital. And they discovered this, and they sent me to basically one of the foremost wound centers in the world in a helicopter. When I woke up there, I had had multiple surgeries to remove the infected tissue. My husband tells me it was as big as a sheet of paper and as deep as a ream. It was at the very top of my leg, like almost in my groin, so I couldn't even see the wound. So I just like came to in this bed. I couldn't move at all. I mean, like if I slid sideways, I had to ring a bell for someone to help me up. I couldn't move at all. And this huge giant chunk of my leg was missing, which really freaked me out. One of my biggest fears about diabetes all along is that some people end up with an infection in like their foot, and that gets amputated, and then it moves into their leg, and that gets, basically you can end up in a wheelchair with no legs. And this wasn't even starting in my foot, it was starting up at the top of my leg. So that was freaking terrifying. During the time I was in the hospital, because most of the lymph nodes on that side were removed, 3 of my toes went black. So I went back to the cath lab and got 3 stents put in my leg. I also had a pulmonary embolism, which basically it's like a heart attack. A heart attack has a blood clot that blocks your the blood supply to the heart, so that some of the heart tissue ends up dying. In a pulmonary embolism, the clot is in your lungs, and it usually comes from your legs. So I had that, which they also had to fix. So that one hospitalization, I nearly died several times. When I finally got out of the hospital, I went to rehab because I had to learn things like how to stand up again. They had to remove me from the bed with a lift and put me in a wheelchair. And I had to learn to stand and to walk again. And I did get, like, I could walk. I had to use a walker by the time I left rehab and went home. But anyway, I saw a wound doctor for about a year. There was a small bit of it that just would not heal, and I eventually got a skin graft for that. And I was able to walk. I had trouble with stairs and even tall curbs. I would need help up. And I couldn't walk like in my yard. I could only walk on flat surfaces. And a lot of that was probably because I couldn't feel below my knees. So I don't think most of us realize when we walk how much of our balance and our ability to walk has to do with the fact that we can feel the ground. I could not feel the ground. So I needed some sort of support in order, a cane, or more often I used a walking stick. Sometimes I'd use like a rollator at the farmer's market when I got well enough to actually walk through it, even with the rollator. And I still had the wheelchair, but I really didn't need to use it day to day. The house was relatively small. There was furniture. I could reach everywhere, so I was fine walking around. After the skin graft happened, I had an issue with my rotator cuff that took a bunch more physical therapy. And then I woke up one day and couldn't breathe. And I called an ambulance, and they thought I had COPD in the hospital. But it turned out much later, I had pulmonary function tests, and I didn't have COPD. What I had was congestive heart failure. Basically, the edema that had been in my legs was now filling my chest, making it very hard for the heart to pump like enough blood to the lungs. And when I would lay down, I would start to drown and couldn't breathe. So I was hospitalized, and they gave me a whole bunch of Lasix, which is diuretic via IV. Basically makes you pee a whole lot to get rid of fluid. And when I left the hospital, I still couldn't lie down to breathe for some time. It was probably several weeks at least. It might have been a month. So a year later, both of these were in the summer. A year later, I had another bout of congestive heart failure. And I did not go to the hospital. I still could barely walk. I was in constant pain. I had got off of narcotics, but when you've been in pain for just years and years and years, they always tell you, they ask you on a scale of 1 to 10, how bad's your pain? When you've been in pain for years and years and years, you just really don't do anything about like a 3 or a 4 or a 5, because you're just used to that. That's background noise. So I was in pain pretty much all of the time. I had severe fatigue, and my life pretty much was I walked from my bed to the John to my desk and back. If the car was parked right next to my front door, like in the yard, not in the driveway, I could toddle out there and have a home health aide drive me to a doctor's appointment or to grocery stores. Believe it or not, going to grocery stores was actually exciting then. It was like my big outing. I couldn't always do it. Sometimes I'd send them with a list, but I preferred going, because it seems like when you send someone with a list, something or other is always wrong. So when I got congestive heart failure again, I decided not to go to the hospital. I was pretty sure I was dying. And I had lots of Lasix, and I just doubled it up at home. I looked up at how much the high dose was, and I didn't go past that, but things got much worse. Like, my home health aide would be there during the day. I couldn't stay awake more than 2 or 3 hours, so I might not even be awake when she was there, but she'd follow a list of instructions and, like, say, cook a meal for me and put it in the fridge. And I'd wake up and she'd be gone and be in the bottom of the fridge, and I couldn't bend over to get it. It was literally that bad. And I could not stay awake more than 2 or 3 hours. I was sleeping at this desk I'm at right now. I could not lie down because I couldn't breathe. And when you're not getting enough oxygen, you're just really, really exhausted. But because, like, things were getting so much worse, I started to think that having home health aides, even over 30 hours a week, wasn't enough. I was going to need to go to a nursing home. And when I had been in rehab, they had, in that particular facility, they had 3 wings. They had a rehab wing, which I was in. They had a dementia wing, and they had a nursing home wing. And though I'd only been there 6 weeks, I utterly despised the place. And the idea of I'm bad enough that I might have to go to one was like, no, I am not doing this. I'm staying home. I'm probably going to die here. And it's fine. You know, I don't want to die in a hospital. Here, I have my kitties. Here, well, I want to say I could eat whatever my schedule I wanted, but not really when I couldn't reach the food. But, like, I don't need a doctor's permission to take a shower. I just need to be awake when the home health aide's here, so I have help. But I wasn't fighting anymore, you know. But after a month of taking a lot of Lasix, my chest did clear enough. And then I started taking a lot of potassium because my legs were pretty swollen. And that started to clear too. And the weirdest thing happened. While I was, sleeping upright in pain, expecting and kind of hoping for death because it was better than a nursing home. But then I felt a little bit better. And I could use my lymphopress, which is a machine that pushes the fluid out of your legs. You can't use it with congestive heart failure because it's going to push the fluid into your lungs. But once the lungs were better, I could use that, take more potassium. My feet were starting to get better. And I don't even know how. I think I must have had, YouTube can be playing on autoplay. And somehow or another, this Dr. Jason Fung showed up on my YouTube. And I was not initially impressed, but he was talking about reversing diabetes, which I thought sounded suspiciously like cure, and I knew you couldn't cure diabetes. But he said something. Type 2 diabetes is basically a cause of very, very bad insulin resistance. The whole reason I was taking 100 units of insulin was to overcome my body's insulin resistance. And when he said this one thing, insulin causes insulin resistance, I suddenly thought, why am I shooting this stuff into my belly multiple times a day? Because it suddenly clicked in my head that taking insulin was making the actual disease of type 2 diabetes worse. He talked about quite a number of studies. One of them was that in 2 weeks of fasting, you could lose 80% of your liver fat, which that's one of the primary causes of insulin resistance, is the liver gets filled with fat, or not filled so much, but surrounded. Non-alcoholic fatty liver disease is what that's called. And that would greatly reduce your insulin resistance to have your liver free and able to function properly. The liver it's a shame they call both type 1 and type 2 diabetes. Type 1 basically is a disorder of the pancreas, and those people do not make enough or sometimes even any insulin, which is necessary for life. Whereas type 2s make way more insulin than normal people. The only thing we have in common is that our blood glucose goes way too high without treatment. And generally, type 1 is a much more serious disease. But given that I had insulin resistance was my primary issue, if my liver got cleared, because while a type 1's primary problem is the pancreas isn't working right, a type 2's primary problem is the liver isn't working right. It isn't metabolizing glucose properly. It keeps making glucose even when there's plenty of it around. It's basically most of what goes wrong on an organ level has to do with the liver. So that was an impressive fact, that you could get rid of 80% of the fat impeding liver function in 2 weeks. But the pancreatic fat also is reduced so that the beta cells could work better. And the beta cells are the ones that make insulin. They're the ones that don't work in type 1 diabetes. So, I mean, while generally type 2 diabetics do make more insulin than other people, as pancreatic fat builds up, that might stop. It's not that I wasn't still making lots of my own insulin even while I was shooting it, but I was probably making significantly less than, for instance, when I was first diagnosed. Anyway, what clicked in my head with these two facts is, if you reduce your insulin resistance and you improve your pancreatic function so that it can make enough insulin, that does kind of add up to reversing diabetes. And these studies Dr. Fung was showing were kind of freaking me out. Like, wow, this could really get a whole heck of a lot better. And what occurred to me was that what he was talking about, this fasting business, he sounded suspiciously like my friend Amanda Rose. During my first bout of congestive heart failure, when I'd come home from the hospital, Amanda had told me she had lost 100 pounds in 8 months. And given that I couldn't lie down and breathe simultaneously, I didn't really care. I mean, I was happy for her, of course, but when she told me about doing keto, I just sort of was like, yeah, whatever. I ate low carb for 2 decades and I just ended up worse. And then she told me about this whole intermittent fasting business, that she was eating 1 meal a day in an hour, and sometimes not that, sometimes doing extended fasts. And quite frankly, when she told me that, I thought she'd kind of gone off the deep end. That sounded suspiciously like possibly a eating disorder to me. So I kind of thought, she kind of lost it. But now that I was seeing that fasting could fix diabetes, and that was the first thing that went wrong with me before the heart attack, before the adrenal insufficiency, before the thyroid problems, before all the diabetic ketoacidosis, which was caused by a diabetes drug, as was necrotizing fasciitis. Oh, and I didn't finish the story about the hospital. They put 3 stents in my leg because several toes had gone black. Within about 6 months, the toe that hadn't healed fell off, like half of it. That class of drugs, SGLT2 inhibitors, now has black box warning that it causes diabetic ketoacidosis, necrotizing fasciitis, and increased risk of amputation. At the time that I started on it, those were not known, because I wouldn't have started on them. But I lucked out. I hit all 3. Lucky me. Anyway, but as he was talking about fasting, fixing diabetes, I'm like, this sounds like what Amanda did, which made a lot of sense to me, because diabetes is insulin resistance. And so is obesity. Obesity is also caused by insulin resistance. It might be a matter of degree. My insulin resistance might have been worse than hers, but it suddenly made a lot of sense that she had lost weight eating 1 meal a day. Yeah, she had told me about it. And like I said, I didn't react well then. But this was now a year later. But now I was getting very interested in this whole concept of fasting because maybe I didn't have to die or go to a nursing home. Maybe if the first thing that went wrong with me could get better, maybe I could get better. She had gone on to start a group because so many people were very interested in her weight loss, and she called that group Eat Like a Bear. The reason she called it that is because bears put on a lot of fat for the winter, and then they hibernate and they don't eat for long periods, and then they emerge in spring skinny. And to illustrate that notion of eating and not eating for long periods, she called it Eat Like a Bear. And she'd made a video called Postcard from Yellowstone, which you should look for on YouTube if you haven't seen it. That had pictures of her and her son a year apart at Yellowstone. And it had just attracted tens of thousands of people to the group. This is a picture from that video, but you really want to watch Postcard from Yellowstone because it's just an amazing video. And it's unlike me babbling for long periods, it's only a couple minutes. So I joined Eat Like a Bear, and I started my first fast on August 2nd, 2019, the same day that I made my first post to the group. And this was just so fast, but within a couple days, my legs began to shrink and I could feel below my knees. And over the course of several days, every day I would feel like down my legs and I could feel further and further. And I hadn't felt below my knees in years at that point. At a week, I decided I was going to go try to walk in the yard without a cane. And I could walk. I mean, I am literally saying I went from nearly dying to being able to walk again in a week. All of the changes I've been through have not been that rapid. But wow, did that not give me hope? Like that I could actually possibly get better. I could have a life again. In under 2 months, I took my last shot of insulin. I was working with my endo, of course, and she also helped me wean off prednisone. And later, after I got off the prednisone first, then my last shot of insulin, then the liothyronine. And at a year, she told me she was releasing me from care because I didn't have any endocrine disorders anymore. And I teased her. I said, "You're firing me?" And she's like, no, you graduated. And she pointed to my medical record on her computer screen and said, "Look at you," because there was a picture of me. "You don't even look like the same person." And wow, like there's just nothing wrong. The diabetes was the first thing that went wrong. I was, by that point, off all meds, even metformin. I had normal A1Cs, not even pre-diabetic, let alone diabetic. And she just was like, "Graduate." So this is a video taken a few months in. Well, it was photos taken. One of the places I liked to go hiking was my local state park called, one of my many, there's a lot of state parks around here. One of them is called Colonel Denning. And I think this was 10 or 11 months in. I was at the park hiking with my friend Denise, and she took a lot of pictures of me that day. And I made it into this video, which I won't play all of because also it's not nearly as motivating without the music. We'll just move along. that was the biggest thing. So going back a bit to how did I start? So it was July that I started to be convinced that this might work, but it did take me till August 2nd to actually start. I was mostly eating keto for that month. And I was binging on all the content of Dr. Fung and Amanda I could find. Dr. Fung has a YouTube channel now where he is working to reach actual diabetics, but back then everything that wasn't even on his channel. It was all talks given to medical professionals and scientists. And I bought his book, The Diabetes Code, and that was written for patients, and I probably read it 3 times. I binge watched everything. I can't tell you how many times I watched the postcard from Yellowstone that Amanda did as well. And I thought about this. And I actually plan to start on August 1st. You know, we like to start diets or resolutions or whatever on the 1st of a month or the 1st of a year or a Monday. But I got a little panicky on August 1st. And I ended up deciding, okay, I'll start August 2nd. And and just before midnight on August 1st, I ate a whole package of noodles, as well as some Polish sausage. So I was definitely not in ketosis when I began, and nor fat adapted, or any of that. I just, August 2nd, stopped eating. And yes, as already confessed, the night before, I had sausage and a whole package of noodles. I've heard so many people recommend that you should be in ketosis before you try fasting, or you should even be in ketosis for a while so that you're fat adapted, so you have all the enzymes to use fat as fuel instead of glucose. And I just started. When I talk about the fact that within a week I could walk, I did not eat during that week. I had coffee. I had water. I had electrolytes. I had really nothing with calories in it. I was putting heavy cream in my coffee, and that's a whole other story. But what drove me when I started was basically just an incredible level of desperation because of my situation. I remember thinking to myself that if I die, I never get to eat again. If I go to a nursing home, there's never going to be anything I want to eat again. I'd had that food. So what the hell? Let's just try not eating for a while. What am I really giving up? That was a lot of it, but a smidgen of it at least is that I can be an extraordinarily stubborn individual, which Amanda could tell you since it took me a year to listen to her about fasting. Actually, it took me another year to listen to her about calories too. I really can be stubborn. The first time I gave this talk, my ex attended, and he just commented repeatedly about how he could testify to my stubbornness. And I aimed that stubbornness at food. Food is not going to make me eat it, basically. One of my questions, because it's become important in my life to reach other diabetics, is what if you're not as desperate as I was? Because most people aren't. Most people aren't diabetic for 30 years. They've probably died before then. And I don't want people to be as desperate as I was. I mean, it would have been really nice if I had fixed this 20 years earlier. I would have saved myself so much pain and suffering. And just years of disability and chronic pain and fatigue. And that plays with you psychologically too, because I was always a type A personality, a high achiever. I did things. I went to college and graduate school as a single mom. I like graduated with high honors and won awards that had never been given out before, and all this kind of crap. So, like, being completely useless for a decade, that I didn't do well with that. And actually even requiring caretaking. I would not wish what I went through on anyone. And yet, I was pretty lucky. I still have both of my legs and 9.5 of my toes. And the neuropathy in my feet was not actual nerve damage, because when the edema resolved, I could walk. I got well enough that I've moved into my own apartment, which you're looking at behind me. And without home health aides, I just live on my own. I just drive. I just walk. I'm not a patient anymore. I am a person again. And every day is full of things I could not do a few years ago. But if you're not as desperate as me, because most people aren't, and I realize that, and I'd rather if you didn't have to become so, we're going to talk about that next week, how you can begin, because you're probably not thinking you might as well not eat, because you're never going to eat again anyway when you're dead. Hopefully you're not in that position. If you are desperate, definitely go find that postcard from Yellowstone video now. You can come join Eat Like a Bear and find me. We can talk. But next week, I will be doing another presentation for people who are not as desperate. Because since I've been in Eat Like a Bear for over 2 years now, I've counseled a lot of people. Mostly not diabetics, mostly people whose insulin resistance is only bad enough that they're pre-diabetic, or maybe don't even have that diagnosis, they're just obese. But I've coached quite a number of diabetics as well. And I've learned a lot about the motivation and the mindset needed to really succeed at making this change if you're not just ridiculously desperate. So I'll be addressing that next week. That requires a whole other set of slides. And at the same time, Thursday, 7 p.m. Eastern. This was me playing because I had just started learning how to use Google Slides and hadn't used PowerPoint in years. This is just a quick illustration of the first 10 months of my journey. Though I did not begin fasting and joining Eat Like a Bear and learning to eat like a bear the way Amanda taught, with any expectation of weight loss, and I didn't care. I just wanted to get well. But as you can see in these pictures, within 10 months, things had changed significantly for me. And I'd lost quite a bit of weight. I've lost more since then, although still have a bit more than I want, working on it. But overall, it was an extremely successful journey that I look well enough to, take pictures of, that I'd allowed to be shown on Facebook, is one thing, but really it is the everyday things that I can get up in the morning and make my own coffee, as opposed to when I had years I never made a pot of coffee. Either Steve or home health aides did it. Even before that, I get up and walk to the bathroom, and there were periods of time I had a potty chair near my bed because I couldn't go that far. Yes, I look way better. I know that. And believe me, I like it. I see myself in the mirror and I smile at who I see. It's not that I don't have any vanity. It's just that the difference in my actual day-to-day life is so extreme. And I see this in the group on a regular basis. People who are amazed at what they can do, the capabilities that they regain, the aches and pains that often we think are due to aging that get better. We call these non-scale victories, and it's just such a huge difference in the quality of your life. For me, enough so that life is worth living, which it really wasn't a few years ago. So I'm done babbling, which it's been, wow, almost an hour. And if anybody has any questions, I'm here for that for however long I have questions. Hello, Georgia. I don't know if anyone's watching on YouTube or not, because I don't see a comment from there, just from Facebook. Either way, it'll be there as a replay, so that works. And everyone who catches this as a replay in the next week, next Thursday, 7 p.m., I will move my story into my discussion into how you can start if you're not as desperate and stubborn as I am, which I hope you're not as desperate as I am, and very few people are as stubborn as I am. It's one of my superpowers. Hello, Amelia. Yes, Georgia, she was. She was an incredibly beautiful young lady and incredibly elegant to a degree that I don't know where she got that from. And yeah, I have a hard time telling my story without crying, which gets a little bit ironic sometimes in the group, because sometimes I'm telling bits of my story almost every day, and I'm sitting here typing and sniffling as I do, telling another newbie some little anecdote that applies to their situation, and typing and sniffling. It's really good for me. It's good for me because it would be so easy to take these changes for granted. There was a day like where I was out of something, I needed to cook something, and I just said, oh, heck with it. And I went, got in the car, and drove to the store, bought it, came home. That was something that would have been impossible for me several years ago. I would have to wait for a home health aide. Frankly, I had to rest up to even go out. I couldn't go out multiple times a day. It would be so easy to take something like that for granted because, like, really most of my life, I took for granted that I could run to the store anytime I wanted to until I became so disabled that I couldn't. And I don't want to take it for granted. I want to appreciate. It's one of the things that keeps me on track is what I have gained and not ever, ever, ever wanting to go back to where I was. So it is, for me personally, my own psychology, my own mindset, extremely important that I always remember where I came from. Thank you, Gail. I obviously enjoy sharing my story, or I would not be doing it so much. I feel I was a biochemist, and I spent years reading the literature trying to figure out how to fix myself. I tried so many things, different hormones, different diets, different supplements. When I realized that this was it, I've simply been unable to shut up about excuse me. I mean, I wanted to find out how to fix diabetes for my own sake. Diabetes was not what I was studying as a biochemist. I was not interested in it until I got it. But just as bad as things got for me, that feeling of I can help people to not have to go through that, and I can help people who are where I was, which, I mean, I joke about it, that I can't shut up about it, but I really, really can't. I saw a woman today I hadn't seen in like 3 years, and she didn't actually recognize me. And she was pretty amazed at my health, and she asked me, and I summed it up with, well, I'm not diabetic anymore. That's, yes, yes, I'm 125 pounds smaller than the last time you saw me, and I got my hair shorter. But the main thing is I'm not diabetic anymore, which causes a level of enthusiasm I have a very hard time not expressing. I can express it just fine. So, I mean, I'm personally just extremely compelled to tell my story. I more worry about people being tired of me telling their story. My story, I feel like sometimes I post too much in the group, um, or because the group is primarily focused on weight loss, and I talk an awful lot about diabetes. As I said, it really is the same thing. It's caused by hyperinsulinemia. If you have too much insulin, you gain weight. If you have too much insulin, you get insulin resistance. Obesity and diabetes, type 2 diabetes, are pretty much the same thing. It's just a matter of extremes. And I hope nobody gets nearly as extreme as I did. So if there aren't any other questions, I'm going to wrap this up because I've been babbling for almost an hour, enough to have gotten a dry throat and had a coughing fit. And I will see everyone next week when we will discuss how you can start. Because if you're not as desperate or stubborn as me, you might need some help. And I will see everyone there. Thank you guys for showing up, and I'll see you next week. Yes.